Hi, my name is Hooray. Welcome to my show, which is Hooray BS Cooking Show. This is an update to the breast surgery that I had on September 8th. Today is September 20th. Yesterday I had my first follow-up with the surgeon, having had the left breast, the implant taken out. A new implant went in. I had what was detected by the doctor through the imaging they had, which was an MRI, ultrasound, and a mammogram. The MRI confirmed a rupture and encapsulation of my left breast. In yesterday's follow-up appointment with Dr. Adam Perry in Bayshore, he brought to my attention that he came to a conclusion from removing the breast implant that there was no rupture. It was only encapsulation. Encapsulation can happen from... Sometimes capsular contracture is caused by something other than the patient's own body reacting poorly to the presence of the implants. In addition to implant ruptures, it is now believed that something called biofilm often leads to the development of this condition. Biofilm is a thin layer of bacteria that develops around implants after a type of bacteria, often staph bacteria, is introduced to the breast cavity during surgery. The bacterium causes a kind of chronic low-grade infection that may not produce noticeable symptoms. However, as the body combats the infection, it produces more and more fibrous scar tissue, eventually leading to capsular contracture. So my surgeon did state that as well, that maybe there was an infection that happened during surgery, which is why in the replacement of the breast this time, they wiped me down. Like, there was a special soap that they gave me to use the night before and the morning. They cleaned me down before surgery. Once I was under, they did like a iodine wash. So it could have been a bacterial infection, because right after surgery I was having pain, and the little pings of pain kept happening. When I got the mammogram too, the technician who was handling my body and putting it into the machine and all of that vice grip thing, she said that the breasts were dense. What they call in this, they're stages, like grades. So yes, I was already grade 2 to grade 3. So grade 3 is that the breast will firm to the touch and appear abnormal, and they started lifting. The breast started getting encapsulated, getting firmer, and it was starting to rise up. So I hope that helps. Okay, back to the show. But I can say to this situation and to all of you, my concern about the rupture has been alleviated, because I was really wondering what caused the rupture. Did the rupture occur at the time of surgery? Did the rupture occur with that interchange that I had, which was a sexual interchange with breast play? Right? So it was my first round of sexual intimacy, breast play that was aggressive. It wasn't abusive or rough, but it was something new, and I enjoyed it. So I was really disappointed about the news of the rupture, and thought maybe that sex brought it on. So I had done research beforehand about the implants, then did research after the news of the rupture to find out that it takes a lot of impact to the breast to cause a rupture. But me, you know, being sort of a worry person, and maybe I still have some work to do about sexuality as a trans woman, I took on a lot of guilt and shame actually about that. But it was strictly touch, body exploration, and he was exploring these girls, honey, and I was really happy with that. But I'm glad that the contact that I had was safe, and it wasn't to the point of damaging my body. There was no rupture. I'm really, really happy about that. So I wanted to come to the camera and to the audience, whomever is watching this and following this breast implant journey and my transgender surgery journey, gender confirming surgery, to let you know that no, there was no rupture, and my interchange on a sexual, loving yet a somewhat aggressive note did not bring harm to my body. So, aggressive away freely in a loving way. Or maybe it's not loving. Whatever it is that you're into, I totally respect, and I'm sure you respect what I'm into. So I just really wanted to come with that update. I no longer require wearing the medical bra, which was very tight. I must wear a bra 24/7 for the next 3 weeks now. So I have like an exercise bra, which is, you know, tight, and there's no wire. I can't wear anything with a wire yet. As you maybe saw in the last video, I still have the steri tape is still there. That comes off or peels off on its own over time. So again, my name is Hooray. I'm a trans woman. I'm Puerto Rican. I'm sober 34 years. I'm 64 years of age. The breast implant February, March, April, May, June, July, August, September. We're going into 2 years, 8 months since I had my original implant surgery. This left breast has a new implant that will be 2 weeks old this Friday. This Friday will be the 22nd. So I had my surgery on September 8th. Yeah. So that's the update that I wanted to provide. And no rupture, strictly encapsulation. I hope my body is not rejecting this new, lovely Christina. She still will be the same name. And I'm just really glad that everything's fine. Okay? So I'm healing, 3 more weeks of low activity, and I'm trying to adhere to that. Alright, ladies and folks, whoever's watching this, they, thems too, and any gents, any he, hims that might be watching. Okay, thank you so much. You take good care. Thanks for your support of Sarai Sabada's Beers Cooking Show. Okay, bye.